They're for men. I don't care if you like him or not. You want one of these. This is topical lidocaine. If you use this, you don't use lube. It is sterile, so you want to open it and plop it on your sterile field after you clean the head of the penis, which I'll show you how to do. You pick this sucker up, pop that off, screws together right like this. If it weren't broken, this one's broken, so be careful. And then you shoot it slowly into the urethral opening of the penis. Let it sit for a few minutes, and you're lubed, and he's numb. Make sure they're not allergic to lidocaine before you do that. This is called a leg bag. It's for walking around. This part connects to your Foley catheter. This part you drain. Figure out where they want it. Some of them will want it down here. Some of them will want it up here. Your ladies sometimes prefer to have it on the inside of their legs. Assess where it's more comfortable for your patient. This is for them to go out in public, so you want to keep it somewhere it's going to blend. You teach them how to clean it. They open it, they let it drain, wipe it with alcohol, and then close it back up. And that prevents those organisms from coming back in. When we send our patients home with catheters, you want to get them one of these. If they walk. Teach your patients how to perform catheter care at home, which I'm going to teach you guys how to do. Even though they're at home with a catheter, they still need to clean it. That means they have to clean around the urinary meatus. And a man, that means they actually pull back a little bit on the penis and clean down the catheter, just like this. And just like when you're stripping JP drains, you keep a firm grip on the top. I got this backwards. And then you strip down the catheter. You will see a ring right here on the men, on their catheters, just from the irritation and the seepage from around the head of the penis. On the women, they also get that, so that's part of doing a hygiene. It's called catheter care. You don't want to mess with where it goes actually in too much because, again, that's sterile. But make sure you're cleaning down that. Teach your patients, if they're going home, to wash their hands before they empty their catheter and to wash them after they empty their catheter. Teach them to do good catheter care. And you want to teach them the signs and symptoms of infection because these are high risk for infection. So bladder burning, temperature, flushing, confusion in the elderly are usual signs and symptoms. This is a Texas cath. Also called a common cath. I saw a guy one night that one of these was put on. It was too small for him. And the head of his penis was purple. And it had been like that for several hours. He actually had a pressure ulcer around his penis from the catheter. This is what we call an in and out cath. You insert it using the same principles as you would a Foley catheter, but you drain into here. You use it for urinary collection. So it's the same as a Foley cath, except for it doesn't have a bag attached to it.
Would you also call those a straight cath?
Straight cath, in and out, yeah. This is a urine strainer. We use these for patients with kidney stones because we want to see them. If you have a patient, you're working in an ER, you have a patient who's going home with kidney stones, you work in acute care, and you're discharging your patient with kidney stones, you send them home with one of these and tell them to screen all urine until the kidney stone has passed. And then they can stop screening. These are some collection kits, and I want to tell you the difference between these. See, this one says sterile right here. In the hospital, these are not. These are. This is what we use for our urine specimens. We use these for stool. Take the top of it, put your urine in it, put the top back on, and you peel this label back. You guys see that? That's a needle. We'll take one of these. This is if you're doing a micro on your urine. Put it down on this. Push it down. It'll fill with urine. It's an accutainer, so it fills. It's vacuum sealed. It'll stop. You put this back over. If you're not sending your urine to the lab, you'll dispose of your urine, and this blue part goes in the sharps container. Usually we send this with this. When you collect, you label at the bedside. Time, date, initials at the bedside and the patient's label. Don't walk away, don't set it down somewhere. You'd be surprised how quickly you can get pee mixed up. If you send it to the lab and you have not done that, they will reject it. Which means you've gone through all that work to put that catheter in that combative little old lady, and now you gotta do it again. Okay, I think that's all I want to show you on that. Alright. So, let's put a Foley in Mrs. whoever. Same procedure as everything else. You're going to introduce yourself, wash your hands, provide for privacy, do your 2 patient identifiers. You want to make sure that you provide for privacy because of where you're inserting this. If you watch the video, it will show you to put a drape here across the knees. And then you remove that right before you put in the Foley. I'm not going to teach you that, but I am going to tell you to get a bath blanket here and a bath blanket here, so you're not exposing any more of the patient than you have to. Okay, put your bed up to your height. Kelly, move that. Yeah, thank you. Who's going to let me play with their catheter kit? Alright, so I verified I have the right patient. I've explained the procedure to her. Mrs. Jones, you haven't been able to urinate, so we're going to put in a Foley catheter to help you out with that. And most times they're going to say, thank you. Unless it's a man, and then he's going to say no because it's going to hurt. And you have to explain you're going to use the numbing. We don't use numbing on women. They don't have a prostate. And we don't want as much. You want to put your patient in the most comfortable position for them and in the best position for you. This is not the only position you can do it. You can do it from the rear. You can do it behind. Put them on their side and insert into from the back.